Are you fed up with chronic sinus issues? Ear, nose, and throat specialist Matthew Connor introduces us to a patient who had a simple in-office procedure that helped stifle his sniffles and prevented a much more serious sinus problem.
I think you'd be a good candidate to do this in the clinic.
The fullness and the pain in the facial area clearly was debilitating. I had had some dental procedures and it turned into antibiotics and sinus headaches, and then I had problems with vision.
Well, Dr. Ford presented like many patients do with a lot of sinus pressure and pain. Because his infection was severe and not responding to traditional medical therapy, we decided to proceed with a procedure to open up those sinuses to drain that infection, and we're able to do it minimally invasive with sinus balloons. Then we're able to insert that balloon using computer guidance into the appropriate sinus, directly into the natural sinus passageway, and dilating that area open to relieve the infection.
I was able to actually get a balloon into the sinus itself, dilate it, and open it up. In fact, we took probably about 7-8 cc's of really ugly looking pus out of that sinus, which we ended up culturing later, and it turned out it's the absolute worst kind of bug that just loves to go into the brain. I felt better instantly. This technology is unbelievable. Saved a trip to the operating room and 2 days in the hospital.
Dr. Connor says anyone who's been treated for sinus infections with conservative approaches like sprays or steroids but hasn't seen improvement is a good candidate for this procedure. For Millennium Medicare Connect, I'm Robert Van Winkle.